Hello and welcome to the same webinar series presentation on efficiency in motion, leveraging technology to enhance patient care. Before we get started, there are a few housekeeping notes I'd like to go over. First, AIM is an industry association for automated identification technologies with 50 years of industry advocacy. AIM works on verifying compliance and harmonization, impacting digital identification and authentication regulations, developing standards, and providing guidance and technology insights. It's the policy of AIM Inc. to conduct its operations in strict compliance with the antitrust laws. No AIM activity shall create even the appearance of a violation of the letter or spirit of the antitrust laws. And then the AIM collaboration and work product policy states that committee meetings or webinars like today's are held for the primary purpose of advancements in our industry, which necessarily involves development of work product intended solely for the public domain. AIM's developed this policy for the protection of its members who engage in this important collaborative effort. And just some additional housekeeping notes. Today's webinar is being recorded. As a registrant, you will be notified when the recording is available. We'll also have a brief Q&A at the conclusion of the presentation. To take part in this, please submit questions via the Q&A option at the bottom of the application screen. So to start, I'll have AIM member Gary Moe, the president and CEO of ID Integration, share some background on ID Integration and their unique expertise.
Yeah, thanks, Mike. Welcome, everyone. Appreciate your time to come and hear about some new technology that we're excited to deploy. And my name is Gary Moe. I'm president and CEO and co-founder of ID Integration. We've been in business for over 23 years. We're based out of Mukilteo, which is just a little bit north of Seattle. And I was looking back, and we've actually been AIM members now for over 20 years. And so our history goes back, our core business is a systems integrator for RFID, barcode, direct part marking, specifically for asset management, asset tracking applications. We did our first passive RFID project with Boeing back in 1999. So over 24 years ago now. So it was interesting at that time, we actually used the microchips that they put in pets. And we worked with Boeing to develop a very rugged rivet that we put the microchip in, and then we attached it to structural parts on the shop floor for tracking. And the system worked great. One of the challenges was at that time, they wanted to see the part number embedded with on the part during manufacturing, which we weren't able to do at the time. And also the readers were very expensive, very large. It was almost like you almost had to hold them with two hands. So we've, through our career, we've seen a lot of changes in RFID technology specifically. It's definitely come a long ways. ID Integration, we've supported the commercial aerospace and military markets. We've worked closely with AIM over the years for the Department of Defense Item Unique Identification program. We work with Boeing and Airbus suppliers on high memory RFID requirements. The airlines now are putting high memory passive RFID tags on airplane parts for configuration management, inventory control. And about 4 years ago, we were contacted by a hospital group that was having challenges finding misplaced equipment, losing lots of equipment each year, problems with inventory management. And they had heard about RFID, and we started talking with them, and we began a program to tag their hospital assets and inventory parts with passive RFID. And today, 4 years later, we've tagged over 140,000 parts in multiple medical centers and hospitals. And in doing that work, we actually have teams of people that go room to room, and we cleanse data, take off the old labels, put on these new, what we consider like smart labels. We can encode the RFID chip, but we can also print the new labels and with human readable barcode to kind of match their current asset labels, which is great for them. But going through the hospitals, we saw the challenges, in talking with them, the hours. We see biomed and nurses just roaming around each day looking for misplaced equipment, not finding assets. It was interesting. We actually found different parts and equipment in a hospital that were, obviously put into closets, but we even found some in the ceiling panels. It was so, at that time we saw the need and the opportunity to use new technology that was being developed, in our hospitals, and so we got kind of excited about that. Then COVID came out, and that was a strange time for all of us. And we were introduced at the time. We were getting requests from some of our customers in different markets and hospitals and even aerospace companies about contact tracing. It was a big issue for a while. So we were investigating different technologies. And then we were introduced to a company, Nav Systems, who we're going to hear from today. And we were very impressed with them. They were working with Apple and working with indoor mapping data format technology, indoor GPS for hospitals. And we began working with Nav Systems and Dr. Siegel, who you're going to meet today, about 2 years ago. And so I'm going to just pass it on to, Dr. Daniel Siegel. He's got some really good information and use cases and real life experience. And, ID integration, one thing unique about us, we do have a Center of Excellence demo lab in our office and lab in Seattle that people are welcome to come through and see all the various passive, active, barcode type technologies, how to integrate with software. But we pride ourselves on being a vendor agnostic. We always try to, we're always testing out new solutions and looking for, the best solutions to integrate with our customer to solve their problems. And so with that, I'm going to pass it over to Dr. Daniel Siegel and let him share some more information.
Thanks so much, Gary. Hello, everybody. Good morning or good afternoon, depending on which time zone you're in. Thanks so much for joining today. And thanks, obviously, to the team at AIM, Gary and the team at ID Integration and everyone at Nav Systems who helped put this webinar together for today. I'm Daniel Siegel. I'm the co-founder and CEO at Nav Systems. We're based out of Ann Arbor, Michigan. And obviously, we're new to AIM, but it seems that we share a lot of mutual interests and work to solve many of the same issues that particularly affect healthcare. And I'm really excited to be with you to talk about some of those very real problems that come from a seemingly simple thing that healthcare struggles with daily, and that's not being able to find things inside these big, complex buildings. And I'll tell you, as a physician, there is nothing more frustrating than not being able to provide care because a piece of equipment or a team member or even a patient can't be found. And I'm sure most of you have spent some time in a hospital as well and experienced just how frustrating it is when care is inefficient or delayed or communication is unclear or mistakes are made because things just aren't where they're supposed to be. Now, hospitals are certainly uniquely complex facilities, both from a size and a throughput standpoint, as well as the number of parallel processes that need to run smoothly in order for care to be efficiently delivered. But unfortunately, it's far too often that doesn't happen the way it's supposed to. And it was that frustration with this experience that led us to develop the idea of what we now are calling care traffic control, which is the ability to easily locate, connect, and manage everything important that moves around inside hospitals. And it really doesn't matter whether that's people, equipment, or patients. They're all important to locate and manage effectively. And so through our early partnerships with Henry Ford Health, as you can see here, as well as with Apple's Map Kit and some of the innovative Wi-Fi-based indoor positioning tools we were able to do with Apple, and now, of course, low-energy Bluetooth technology, these form the core of what has become our platform today called NavTrack. And based on that success of building what we'll show you here that we did with Henry Ford, Nav Systems was formed as a spin-out company from Henry Ford Health in 2019, and we've been growing in this space ever since. So my hope is that after this discussion, you'll all be better informed about not just the importance of accurately tracking and managing these sorts of things in healthcare, but in doing so in a way that really recognizes and improves the specific workflow challenges that are necessary to be really a value add for healthcare. At NAV, we like to talk about how when we perform well, we're helping healthcare be better, which has the potential to impact millions and millions of patients and providers, and that's really meaningful. This is an important point. Regardless of the industry, real-time visibility gives superior workflow control and insight to streamline process. This is really a guiding principle, not just for here at NAV, but probably for any of you that deal with workflow and process, that if real-time visibility is core data, it's necessary to effectively plan, monitor, and proactively manage both people and equipment. And you need to connect the two in order to really be effective in this space, especially in healthcare. So many of you have probably heard about the challenges that healthcare went through during and after the COVID pandemic. And truthfully, and I guess unfortunately, not a lot of these have been solved yet. Unfortunately, a huge number of healthcare staff have left the workforce and don't appear to be coming back. There's ongoing shortages in a number of key areas, especially nursing, but in almost every area. And this is why automation has become so important. There simply isn't enough time in the day for most folks to do all of the clinical tasks required of them, let alone low-value things like wander around and search for equipment. There's a popular concept that's talked about in health there. It's called working at the top of your license. And that really translates to enabling staff to focus on the things that matter, which really should be patient care. And so any tool that can help a clinical team do more with less is really powerful, and especially nowadays. Now, unfortunately, it's not getting any easier as hospitals are under more and more pressure to perform. And this has led to a huge problem with burnout. It really is a burning platform, no pun intended, when you see how much frustration there is, again, particularly among nurses, how much turnover there is, how many are leaving healthcare altogether due to burnout. There is an acute need for tools that can help them do what they really went into that profession for, which is to help people. So what I'd like to share here is the experience that we had with Henry Ford Health in Detroit, where we were able to transform a system that started with no maps, no data, no insight, no location information. And I will point out, this is the norm for most hospitals in the US. We were able to help transform that into one with real-time visibility for the location and status of their people. We started with their transport service, the ones who move patients and equipment from place to place inside the building, and empower them with the information they needed based on location to make actionable decisions about how, when, and who to assign jobs to, and move patients more efficiently through the hospital. The requirements were fairly straightforward. We had to use what was already available. Now, I mentioned how hospitals are struggling. And this isn't just with people, it's with cost. You've probably seen the stories in the news about how some large health systems are reporting quarterly losses in the hundreds of millions of dollars. It's staggering. There just simply isn't budget at most healthcare systems these days to spend huge amounts of cash on equipment. And the interesting thing about transport, moving patients from place to place, is it's a pure cost center for a hospital. There's no money to be made on transport itself. So it's particularly important that it run efficiently, because if it doesn't, key measures like length of stay, patient throughput will suffer. So we had to use things that were already in place, like the existing Wi-Fi networks, like the smartphones that were already in place and were used to do some of the communication, but not necessarily the job assignments, and certainly not able to see the location of those who were carrying those around. And so we understood that what was in place were a lot of the pieces that were needed to build an accurate and cost-effective location management platform. We worked very closely with Apple and their Maps team from the very beginning, and we're the first ones to figure out how to do this at scale in healthcare. If you know anything about indoor mapping, it started in malls, airports, and other big, wide open spaces. And that's because those are relatively easy. They've got lots of square footage, but not that many rooms or corridors. Hospitals, on the other hand, are a very different animal. They're a maze of old buildings, multiple expansions, conflicting floor names, poor signage, bridges, tunnels, so on and so on. And yet we were confident that with good maps and a good understanding of how to give visibility to workflows, that we could use the existing iOS mobile devices as a source of location information, and the existing Wi-Fi network as the source of indoor positioning, the indoor GPS, so to speak. And in doing this, we also understood that it needed to be fast, it needed to be near real time in order to accommodate the responsive nature of healthcare. And to take it a step further, we knew that it had to work across multiple buildings, indoors or outdoors, to understand that a lot of hospitals are set up like campuses, and there's transitions from outdoors to indoors. So it really had to be based on the Global Information or Geospatial Information Standard, the GIS standard for mapping, which uses actual latitude and longitude for location and not an arbitrary XYZ coordinate system. And that's why we settled on the what is now the industry standard called the Indoor Mapping Data Format, or IMDF. And with that as the base of how things are being visualized, what you see here is really the mobile and the web interface to what we built with Henry Ford, which is the platform that we call NavTrack. And what this does is it gives a real-time command center type visibility to allow healthcare teams that command and control capability to see where everything is, much like an air traffic controller would have over planes from their tower. And now this location information for the staff typically comes off their mobile phones, which run an app that can ping location back to our server. But it doesn't have to come from a phone. It really can come from anything that moves around and is connected and has the ability to send location. And so if staff are not carrying a phone, they can wear a Bluetooth badge. And the location information could also come from a network of low energy Bluetooth tags that can be put on equipment, whether it's smart or quote unquote dumb. The exciting thing about these low energy Bluetooth tags is that they're small. They come in lots of different form factors that work well for healthcare. They've got excellent battery life. And when you think about every phone having Bluetooth built into it now, when you combine those two technologies together, you've got a really versatile distributed network of sensors that can now interact with these devices and these tags in a variety of useful ways. So to emphasize just how important visibility is in a healthcare environment where it's traditionally been relatively difficult to do, I wanted to show you, here is a zoomed in map of a single ICU. And this should give you a sense of just how much important equipment sits in a single area. It may be a little small and hard to read, but we've got a couple dozen pieces of equipment. On average, it can be about 5 or 7 pieces of equipment per bed. And now, instead of worrying about having enough of the gear that the team needs to get their jobs done, or wasting time searching for it, clinical teams can actually focus on the actual care. And this can really change behavior. Previously, and in a lot of places, struggle with problems around stashing and hoarding of equipment because there's this sense that there's never enough of it. Well, if they have the confidence to be able to go to a map like this and see where everything is, that goes away. Support services teams like facilities, sterile processing, clinical engineering can now quickly find the equipment that needs service or cleaning, or monitor rentals and leased equipments to make sure that they're rapidly turned around and sent back so they're not paying for unused equipment. And finally, Utilization at the point of use can be accurately measured, which can inform purchasing decisions at the system level. And this can be really important when you consider that a typical 1 million square foot hospital might have several thousand of these items. Right sizing the fleet of equipment can save millions of dollars annually. So what's important here from a solution standpoint is that location is really a key data and that it should be universal, especially in healthcare. The location awareness empowers workflow automation, and that's a key part of how we helped Henry Ford and how we help other organizations in healthcare do more with less. The basic of the technology, which is really our workflow engine, is pretty simple. We enable location with these high quality maps that I showed you based on the IMDF standard. And then we have a flexible indoor positioning system that can take information, whether it's from Wi-Fi, iOS, Bluetooth, or a number of other sources. Really anything that moves can be enabled to stream its location back to our command and control server, which processes, interprets, and displays those in that interactive map-based navigator that you saw just now. And what that gives these teams is all the information necessary to coordinate workflow. And that's what makes the concept of care traffic control so powerful. In the case of transport services at Henry Ford, we were able to generate almost a 20% improvement in response times and end-to-end run completion times, which seems like not a big deal, but it is a big deal because time really is of the essence when you're talking about getting people through an emergency room or getting people in and out of an operating room. It's super important to do things like consolidate workflow. And they were able to do that and actually do their workflow with fewer staff. They were able to also completely eliminate pagers, which had been a big source of not just cost, but also difficulty with their communications. And in the end, the transport teams were more satisfied with their work, as because their jobs are now being assigned based on location, they can walk less, but accomplish more. So they have a far lower level of frustration than having to kind of go all the way across the hospital or do what they're perceiving as non-productive tasks. So the impact is really, if you think about care traffic control being the synergy or the integration of these various technologies, it's not so much about the location. The location is important, but in healthcare, it's what you do with these locations. And I like this quote from the former supply chain vice president at Henry Ford, where he says, "We primarily focused on using the indoor positioning system capabilities around location and proximity to better assign tasks and look for efficiencies, and at the same time, eliminate pagers and consolidate the devices." He alludes to the fact that we were also working with environmental services and support staff, which is a key point as well. There's these kinds of workflows are not just for clinical staff. They can apply to support services. Really anything that moves inside the hospital, we believe can and should be synced up so that decisions can be made to position them where they need to be to provide the care or service that is needed, where it's needed, when it's needed. So in terms of key takeaways, this is a dynamic mapping system and it functions through the existing Wi-Fi infrastructure. It did not require the installation of any additional hardware other than the phones that were already there and the Wi-Fi network that was already there. Hospitals can leverage this location visibility as a basis for smoother communication between their dispatchers and their staff, and this can be utilized for multiple service teams. The employees were able to use location-enabled smartphones to be able to check in and check out and have a device at the beginning and end of every shift. They did not have to assign these one-to-one. There was a pool that essentially when they clock in, they're able to get one assigned to them that has their location for the day. They're signed in, and at the end of the day, it's plugged back in, charged, and ready for the next shift. And this technology can be really useful for hospitals, not just Henry Ford, to focus on the things that matter, namely faster throughput of patients, length of stay, and improved visibility and awareness for their staff.
Great. Daniel, thank you so much for all that information you provided. Greatly appreciated. And Same for you, Gary. So I will get into just some of the questions that we have, and there's still some time to send questions if you'd like via the Q&A option at the bottom of your application screen. The first question, I think this would probably be for you, Daniel. It's just someone was looking to, I guess, get a better understanding of what that indoor standard you had talked about was and how that affected the application that you guys made.
So I think the question is about the indoor mapping data format.
Yeah.
Was a format that was created by Apple back in, I believe, about 2014 or 2015 as the GIS format for indoor maps. And it's evolved over time. It was just recently accepted as a global standard. So it's now what Apple, Google, all the big mapping players are using for the base maps for any indoor map. It uses the GIS standard. So every point that is registered on it is a true latitude, longitude, and it can handle altitude and floor level as well. So it really is very adaptable and accommodates all the levels of detail that you need to do this kind of mapping in a healthcare environment. And then the other thing I'll point out about why IMDF is important is it's geospatially referenced. And what that means is that when you plot the location of a person or a device, they're registered in space. If they're on the third floor of the building, you can zoom out and you can see all of the surrounding areas, just like you were going through Google Maps or Apple Maps or whichever mapping service you're using. And if things move or leave that building, you can see that just as clearly.
Thank you. Another question we have is, what are some advantages of minimizing infrastructure for workflow, equipment, and asset tracking in healthcare settings? And then how can technology play a role in achieving this goal, and what benefits can healthcare organizations expect to see as a result?
I might just jump in first. As a systems integrator, we're the company, the one-stop shop that, is responsible for the installation, working with our customers, the setup, the training, the software, the hardware, the maintenance, the support to roll out a successful system. And, working with IT facilities on running power over Ethernet, PoE and Ethernet drops is always a challenge, working with IT. And that's where, when Dr. Siegel and his team showed us how they call it fingerprinting, I think that's still the name, but how we can go through a hospital with our iPhone and just map out a whole hospital through their existing Wi-Fi network and not have to install transponders and gateways. And it was, that's huge, not only in cost, but the complexity, the maintenance and support, and just the timing to deploy a system takes a long time to coordinate that. So from us, that was in my opinion, that's really a game changer in many cases.
Yeah, Gary, you really nailed it. Simplicity is key, particularly as hospitals are tightening budgets and looking to consolidate on platform technologies that can help them use things like location for multiple services. The ability to do it without having to put in a fixed infrastructure that can cost, in some cases, millions of dollars is really, really beneficial. And the speed in which a infrastructure-less system can be deployed is also, you alluded to, is a huge advantage to getting this in the hands of people and getting them to realize the power of accurate, reliable, real-time indoor location.
Yeah, and it seems like in hospitals, they bang into stuff a lot too, right? If you put a sensor, even in an outlet or on the wall, there's a lot of movement going on and things that can happen. So
it is a hostile work environment for the equipment.
Yeah, for sure.
So the next question we have is interference a concern when using smartphones for location tracking in hospitals, and how can that be mitigated?
Well, I can address that, and maybe Gary has some comments because he's probably seen this at a larger number of institutions than I have. Interference has been a concern for a long time, I think, but has never been proven to actually cause problems. We've seen a number of different systems, whether it's RFID, whether it's Bluetooth, low energy Bluetooth, or these Wi-Fi based systems used very effectively in clinical grade environments, in all kinds of old buildings with lead lined walls and lots of equipment in place, and have not seen any issues with any kind of interference in the real world.
And I would add, I think it's important to do, to work with a technology company, systems integrator that has some experience in deployments and installation. An initial site survey before deploying, super important to go out and actually, try this, set it up, maybe even sometimes a proof of concept to a pilot project to a full scale rollout. There are lessons learned, but we've not seen major interference problems when designed and installed properly.
Great. Another question that we have, we got it a couple times, so I'm just kind of rolling them together into one. So how can healthcare organizations balance the benefits of location technology for the workflow optimization with the concerns about individual privacy?
That's a great question. And maybe I can add a little bit of color here with some stories that I've personally experienced, and I know a lot of friends experience. There has been a tremendous increase in the number of assaults of healthcare workers, particularly in areas like emergency rooms, but really across the hospital in behavioral health areas. There's a perception that it's becoming an unsafe place to work. So I would actually flip this around and say, instead of thinking of this as a technology that is a big brother technology, this is the kind of tool that can help keep people safer. Because if you know where your teams are and you can enable them to activate things like duress systems or alarms that can be built into the badges that they wear based on either RFID or Bluetooth technology, you now know where someone is in trouble. You know it immediately, and you know who to send based on their location or proximity to that area. So that is a big feature of these sorts of location-based systems that can respond to emergencies. And in addition, you also have the ability to see and know who is in what parts of your buildings if you have any sort of disaster or any sort of incident within the building that you now need to say, okay, oh my God, do we have 50 people in this one department, or do we have 500 people in the department? And done properly, I think you can balance the risks or some of the concerns around the tracking of people. Really, it's the devices and the equipment that's being tracked, but that's a whole different issue. But balancing that with the benefits that it can provide from a safety and security standpoint.
And I also, I know we've had discussions within the nav track software. There is capability to geofence or, to make sure people aren't tracked outside of a hospital or in certain areas of a hospital, to work with the teams, at the hospital for any privacy issues.
That's exactly right, Kelly. Yeah.
Another question we have is, if they are not using an iOS system, is there a solution for them? Or what should they do?
So currently, the NavTrack platform is only available for iOS. We are looking at the best ways to enable this for all technologies, whether that's native Android, whether that's web-based responsive apps, whether that's other ways of getting this location, which is really the most important thing, is getting the location off of the device. And we do have plans to eventually enable that for as many devices as possible.
Another question we received is, are you using or thinking about using drones at all for these processes?
Great question. We're not currently, but we are definitely working with a number of drone and robotics groups that would be looking to use the maps and the workflow coordination information that we have to guide those devices, much in the same way that we would guide human tasks. It really comes down to knowing what the job is, where it needs to be done, and who or what it needs to be assigned to. So if you're thinking of drones or robots as delivery, they just need to be given the right information to be routed from point A to point B. And so, yeah, yes, absolutely.
Great, thank you. Another question we have is, if the hospital is committed to using GS1 standards, how would this real-time location system map to EPCIS?
So I'm not a super expert on that, but I think the question is getting at the GS1 system for supply chain locations and making sure that those destinations are available with the latitudes and longitudes of where those deliveries are supposed to go. And if that's the gist of it, then yes, those can easily be built into our maps and our workflow and help to coordinate things like supply chain deliveries. Again, it comes down to the chain of custody. Who is moving it, what is being moved, and where does it need to go? And if that can be encoded as a latitude and a longitude, or there's some other format, we can ingest that and display that and coordinate the workflow around that with our platform.
And as a systems integrator, we are impressed with the NavTrack platform, the flexibility of it to work with, low energy Bluetooth. We're in discussions with them. There's some new ultra wideband technology coming out. Even smartphones now are, incorporating ultra wideband, passive RFID. It's a platform that can work with multiple sensors. Same thing on the data side. When we go into, different hospitals have different, asset naming ways they operate, and it's database input. So it's a very flexible platform. And GS1, UDI, we do a lot of work with companies on UDI, med device manufacturers. So that's all easily imported into the NavTrack platform.
We have another question from a master student who's working on RTLS for their research. They wanted to ask, what are the disadvantages of using RFID as above the distance constraints?
Well, I wouldn't necessarily call them problems, but I think it's important to understand the advantages and disadvantages of every technology, because there are certainly use cases where RFID, and Gary can attest to this, is very applicable. It's inexpensive. It's got the ability to tag large numbers of things very quickly. You can put barcodes on things so they're human readable. And it has its place. And that's exactly why we've built our platform, the way we've engineered it, to be agnostic to the source of location. RFID may be very useful for tracking large amounts of inventory, whereas low energy Bluetooth, we like because it has particularly applicability to the moving pieces of equipment, your things like IV pumps or things that are moving frequently enough that you don't want to have readers or gateways at every single point where they need to be seen. We want to enable that more global visibility of the things so that the teams that need to find them can find them. So it's more about educating yourselves about the advantages of disadvantages of one versus another, and then putting it in a way that makes sense for the specific healthcare workflows. The other thing that's nice about Bluetooth is that many of the workflows in healthcare are now mobile. You see more people doing things on tablets and iPhones than you do on fixed computers or even laptops. And to be able to take advantage of the Bluetooth sensor that is built into these phones and tablets to now be able to remotely go around and read the tags that are on pieces of equipment is a very valuable synergy of those two technologies.
And obviously AIM is very involved, especially in passive RFID with the RAIN. And it's been amazing to see the improvements in the passive RFID technology with the new chips, antennas coming out. I think I heard there's going to be 30 billion passive RFID chips manufactured this year, the readers. But still, in a hospital, and when we're talking about medical equipment and devices, putting passive RFID on metal parts needs to be done, very carefully. And definitely the read ranges for passive are not as long as active, which includes a battery. So we see, within a hospital and large organizations, really the whole, the hybrid type system. Obviously the active RFID, low energy, Bluetooth, ultra wideband, Wi-Fi tags are much more expensive than a passive tag. So there might be applications where that's fine, in certain cases. So again, a solution that can handle that hybrid type, passive, active, and even barcodes. It's all about data collection, automated data collection, which AIM is all about. So, and having a flexible platform like NavTrack is important to be able to take that data from many different sources.
And then the other thing I would point out is there's evolving, innovative technologies that may have benefits beyond some of the things that we already are working with. So ultra wideband is something that Gary alluded to that is rapidly coming towards us, gives you the ability to do directionality in a way that some of these existing technologies haven't quite been able to do yet. Private 5G networks may be able to do many similar things to ultra wideband. And then there's other things like geomagnetic fingerprinting and other technologies that really it comes down to what is the application that you're looking to do with it and what fits best for that particular workflow, especially in healthcare.
And another question we have is, what impact will AI have on your products and services, especially in regards to risk, security, and privacy?
So, AI means a lot of different things to a lot of different people. And to us, where we see AI or algorithmic insight into the data that we're collecting being most useful is in automating some of the jobs that are either difficult for people to do or very time consuming. So I see it being an augmentation of being to sift through all of the location logs of thousands or millions of transports or movement of supplies through the hospital and being able to gain insight into where bottlenecks are occurring or automate the assignment of tasks either to robots or drones or people, whichever is most appropriate, but making those decisions in rapid fire sequence rather than waiting for a person to do them one at a time can be really beneficial from a throughput standpoint. And then the next step going from being responsive like that will be to be predictive, anticipate surges, help right-size staffing and equipment based on historical data, and even help with the planning and design of new facilities based on what we learn about the throughput and about the movement of people and equipment and how they interact.
Great. And do you allow the use of manufacturer UDI barcode on equipment in your application?
Yes.
It's a quick one. Are you working on integrating MapTrack LIS with EPIC, Cerner, or another HIS system?
So I think that question is asking if we're working to integrate with the various electronic medical record vendors. And the answer is yes, that is in progress.
Great. And then the last question I have here is, will you guys be at the HIMSS Healthcare Show?
Yes, we will. I don't know if any of the folks on the call will be going to the Vive show next week in Nashville, but I won't be there personally, but some members of our team will.
Yeah, and I'll be at HIM's show next month in Chicago, and with Dr. Siegel and his team. So if there's any interest in wanting to get together while we're there, please reach out to us.
Yes, please.
Speaking of that, here is the contact information for Gary and Daniel. I'll give everyone a moment to review that. And again, I do want to thank Gary and Daniel for your time and your insights today. Greatly appreciated.
Thank you.
Yeah, thank you for hosting us.
And just real briefly, the AIM contact slide, if you have any questions or comments for AIM and want to learn more about our industry association, our information is right here. Thank you to our audience for your active participation today, and have a great rest of your day.